Rising Above Shadows of Abuse podcast. I'm your host, Grace Osba.
Trauma can be embedded in our bodies, as pinpointed by my previous guest, Biodugbanboye, on our last episode. Today's conversation is with an experienced psychotherapist, Sharon Anderson. We will be discussing trauma and PTSD, post-traumatic stress disorder.
She's been a psychotherapist for 15 years. She's a supervisor. She has her own practice and is an accredited member of BACP, which stands for British Association for Counselling and Psychotherapists. Welcome, Sharon.
Hello. Hi, Grace. Nice to be here.
Today, we are having a conversation. We'll be talking about trauma, like I said. So, what is trauma to you?
Right. To sort of talk about clinically, when we talk about trauma, I mean, it's a kind of, the word trauma comes from the Greek word, which means wound. So for us in counselling, we see trauma as a kind of psychological wounding, which has come about through some event or somebody witnessing an event. And it could be something to do with wartime, which is quite common with veteran post-traumatic stress. We have issues of domestic violence, child abuse. It could be a car accident, or it can even be acts of terrorism or state abuse. And what will happen usually is it impacts the person's psychological comprehension of what's going on. They feel overwhelmed, and their immediate response really is the fight or flight, is to avoid it, to block it out, to shut it out. And this is the brain's way of helping you survive. We know through research that with time, the brain, is a great survival machine. It tries to push things back in a way that it manages that traumatic event. But for many people, they haven't managed to go through the pain or the recognition of it. They haven't got the resilience. So what will happen is they start to develop post-traumatic stress. And post-traumatic stress can come about quite soon after the traumatic event, or, which in many cases that we see in counselling, it can emerge years later. They've just completely suppressed it, and then years later things start happening, they can't make sense of them, and then it's almost as if the trauma is trying to come back. The reason why it's trying to come back is it wants to be healed. It wants to sort of like bursting a cyst. It needs to be healed. It needs to get out.
Thank you. I was actually going to talk about clients carrying wounds of trauma, abuse, and neglect. These dynamics don't just impact their current relationships with partners, family members, friends, and co-workers. They can also play out in the therapeutic relationship, which you've just analyzed. So would you want to talk more about this, playing out in the therapeutic relationship?
Well, I think with the therapeutic relationship, what we try to do, the first thing we try to establish in therapy, before any methods or interventions, is the relationship. So we try to create a relationship which enables the client to feel safe, to feel understood, to feel heard, and to feel contained, so that they can manage to talk about anything, and things that may come up, should come up in a place of safety and connection. What will happen with with clients with trauma or even post-traumatic stress, is it will take more time for that relationship to develop, for that trust to develop. And it's almost in the relationship with the therapist, they shift in the relationship to themselves. So once they start to relax more and to open more, things may start coming up. But initially, you may find them avoid things. They will talk about different things, or they will intellectualize. They don't want to dig deep into the emotional area because either they've completely cut off from their emotions, they're confused by their feelings, or they may feel judged So you will find a client who has post-traumatic stress or a history of post-traumatic stress that you really have to work on the relationship more than the techniques.
That is quite correct, Sharon. The therapeutic alliance, they have to feel contained, safe, in a safe space. And then not necessarily in the first session, because for the first session it's contracting, getting to know your client.
Sort of information gathering,
Yes, information gathering. And then possibly when you have the second, not necessarily the second, possibly the third or fourth session, they start opening up. And then you are able to kind of analyze or dive into the essence of how deep the trauma your client has gone through, if I'm right to say that, because that's what has transpired when I had clients with who has gone through abuse or neglect, and they have kind of, had trauma embedded in them for years. So for me to kind of be able to elicit the right responses, I have to build a trusting relationship with them. And it doesn't just happen overnight. It might be the third or fourth session, like I said earlier on. And, talking about trauma, we have different types of post-traumatic stress disorder. And we have different symptoms. I know you're aware of that. Do you mind me talking a bit about that?
Well, symptoms can range from, I suppose, the kind of classic where they may develop panic attacks, panic disorders. There may be forms of depression. They could even, it's very much in the body. They could also feel very distant from themselves. They could start dissociating, so that there is a kind of strange sense of reality. And all of these behaviors, in a way, are the body's way of avoiding the trauma, because they don't know how to cope with it. They don't know what to do with it. It's just like an alien body. So they practice a lot of avoidance. There's a famous book called The Body Keeps the Score, because a lot of trauma becomes psychosomatic. It goes within the body. So you could impact on your sleeping. It could impact on your sleep, the way you eat. You could overeat. And you may develop addictive behaviors, drug, alcohol, or even in relationships. And you may also find yourself, which we found in domestic violence incidents, that the person who is traumatized will trauma bond with an abuser. And there's a sort of a psychological kind of need that you're seeking out a trauma because you're familiar with it. You can't make sense of it. And you're trying to repair it. So a lot of behavior, which it doesn't seem rational, but it is the person's way of trying to respond or cope with the trauma.
Okay. So, for trauma bonding, it's an emotional bond with an individual that arises from a constant pattern of abuse and is often perpetuated by irregular reinforcement through rewards and punishment. For example, you feel very close to someone even though you're not, or you've not known that person for a long time. That's exactly what you just described. So, in terms of a trauma, I think we could say, like you earlier mentioned, it could be physical, it could be emotional, it could be psychological, and like you rightly said, there are signs like for emotional, you feel a sense of sadness, anger, you feel denial, fear, shame, guilt, which sometimes leads to nightmares, insomnia, and difficulty with relationships. And when that happens, the person has excessive outbursts, emotional outbursts, like weeping excessively, maybe something triggered it and they just start crying. And then we have physical symptoms like nausea, dizziness, headaches, bodily pains, changes in appetite, altered sleeping patterns, and maybe bowel problems. And then for psychological, like you've rightly said, we have PTSD, which is post-traumatic stress disorder. And when they have post-traumatic stress disorder, they have depression, anxiety. They might abuse substances like alcohol or drugs. But not all traumatized persons develop PTSD. Do you agree with that?
Yeah, well, they sort of talk about, the research on trauma will say, trauma itself is a when you are traumatized, you're reacting to an event. It's time specific. There's a war situation, there's a car accident, there's an unexpected death, there's a physical, emotional abuse. It's a traumatic event. Post-traumatic stress is what lingers. It's what happens when the trauma wound is not healed sufficiently. For example, it may take you a month, 3 months to get over maybe a war situation, but you're going through the pain, you're processing it, and it's becoming sort of part of your history. With post-traumatic stress, you didn't heal the wound. What you did is you buried it deep down inside, whether in the body, in the mind, and you don't do it deliberately. What happens is that you may not have the resilience because of your past history, the way your own coping mechanisms. You may lack all those things. And in fact, we have a list of people that protective factors that stop you from developing post-traumatic stress. Okay. And they would be continuous contact and support from important people in your life, disclosing the trauma to loved ones, identifying as a survivor as opposed to a victim, finding positive meaning in situations, and helping others in their healing process. So that, and the research shows that people that have been in groups that have been in traumatic situations react differently to it. Those that have no resilience, low resilience, probably adverse childhood experiences, will have more likely develop post-traumatic stress than those who've had a better support system, develop resilience, have got hope for the future, a lot of positive things going on around them, and feel supported and understood. These people will have processed the immediate trauma, but they will not go on to develop long-term symptoms of post-traumatic stress disorder.
You are quite right, Sharon, because like you've actually said, this leads to us talking about the different types of PTSD. Like you said, there's the normal stress response, which occurs when healthy adults who have endured a past or one-off a traumatic event during recent past, they experience emotional numbing, dissociation, isolation from loved ones. And like you said, it heals quickly in a couple of weeks. But when you have the second type of PTSD, which is the acute stress response, it is more severe and characterized by panic reactions, cognitive issues, distrust, inability to maintain self-care, work and relationships. And often treatment like medication, antidepressants, is normally prescribed, and it's a place of safety, and counseling comes into play, therapeutic interventions. Then we have the third one, which is the Uncomplicated Ptsd, which is a result of experiencing a singular traumatic event, not multiple but repeated instances of same trauma. And this is one of the easiest PTSD to treat. And you can use CBT, which is a cognitive behavioral therapy. I think you do use CBT for your interventions, Sharon?
Yeah, I mean, just what you said, that if the event is just a one-off and it seems to be quite an uncomplicated trauma, not the sort of going on and on throughout life, abuse, childhood abuse, domestic abuse, then it's easier to treat because it's easier for the client to be aware of what happened and they could focus on that. And basically what they want help with is processing it. So what we use in CBT is the kind of image of tidying up the cupboard, really, that everything seems to be in a mess in your mind and you can't quite work out what happened and what you were feeling. So through the process of them sort of going through sort of cognitions and thinking more clearly, they're able to sort of move on and separate themselves from the event, but also process whatever pain and distress that it caused them. So, I mean, CBT is more of what I would call it's a good response to more uncomplicated forms of trauma.
So, do you agree that it's a quick fix?
It's a fix for the type of trauma that needs fixing, as in it's a one-off and it was rather shocking and they've come to kind of share that experience with somebody who can listen. There's still a lot of listening in terms of interventions in therapy and making sense of what happens, because sometimes they simply can't make sense of what happened. They're all sort of confused. So with the cognitive behavior, we can look at it rationally, we can go through the steps, and they start to feel as if they processed it and they've made sense of it, which is really important for them. So in that, it is a quick fix. It's a fix that helps more simple, uncomplicated traumas.
Thank you, Sharon. I don't normally use CBT in my therapeutic interventions. I use other interventions like the SSP, but I'll talk about that in more detail when I talk about the next type of PTSD, which is the Comobid Ptsd, which is associated with at least one other psychiatric disorder, such as anxiety disorder, GAD, general anxiety disorder, SAD, which is a seasonal disorder. And also, apart from anxiety disorder, we have depression, we have substance misuse, and altogether, these are not treated in isolation, but they are treated together. So, and also we have the complex PTSD, referred to as this disorder of extreme stress. This is very severe, and it presents in persons who have endured intense and prolonged periods of abuse, like verbal, physical, or sexual abuse, and mostly the three put together. And such people experience what we call borderline disorder, antisocial personality disorder, behavioral difficulties, which include impulsivity, emotional issues, eating disorder, like anorexia, bulimia, cognitive problems, and substance misuse. So like I said earlier on, the therapeutic interventions I normally use is the SSP, which is the Safe and Sound Protocol. And this was developed by the world-renowned scientist, Dr. Stephen Porges. Here we use the auditory system, and it directs connection to the nervous system to restore the brain and body's ability to find states of calm. So the essence of using this intervention is to make sure the client is calm and safe and they are able to regulate. And whilst doing this, it reduces the amount of stress the client is experiencing, and it also makes them sensitive. Using this also helps them to engage very well in terms of communicating very well and being sociable. That is social engagement, and also fosters resilience, being able to cope with, diverse situations. when we use this technique, it enhances improved communication and successful therapy. So I don't know whether you've used it before. Have you, Sharon?
No, I haven't used that, but I'm very interested, and I'm the work of Stephen Porges, because he started to shift a lot of the treatments towards more. He took on the whole idea of the mind, the polyvagal system, and that we have biologically, we have, this need for safety first. So when someone's in post-traumatic stress, all they're thinking about is safety. They avoid everything, every outside stimulus. So what he wants the therapist to do is to be very, he wants the therapist to really connect with that client, so that client's whole system called the polyvagal system starts to relax and open up. Otherwise, the client will be in a state of fight or flight or freeze. They will not open up to you. They will not feel safe. They're not doing it deliberately, but the body, it's so, we've got to think of trauma as a very embodied condition. It's not just in the mind, because your mind will play tricks on you and you'll think, oh, I'm okay, or what's going on, and you'll avoid situations because the instinct is to avoid pain. But I know that Stephen Porges is really at the moment on the cutting edge of some of the treatments for trauma, post-traumatic stress at this moment. I mean, there's also the EMDR treatment that was very popular, that is used with the eye desensitization movement, which is, again, not using any talking, but really getting the clients to use body kind of responses. So a lot of treatments, I actually think, for me, when I work with a client, as well as the actual talking cure, I always ensure that they're developing their own sense of well-being, whether it's through walking, yoga, practices that they can focus on something positive and that builds up resilience. So it's not the focus continually on the trauma, because we have to be careful not to trigger them, to sort of keep them balanced. But yeah, I mean, this treatment seems very interesting that you've mentioned, and I'm probably going to have, I would definitely have a look into it. Could refer some of my clients that are stuck. Maybe it would benefit them.
You're quite correct. The safety first is quite vital for the client who's going to experience neglect, abuse, or trauma. And, there are also other things we can use for the treatment, like mindfulness and meditation, I've noticed that with some of my clients, they prefer to use mindfulness, maybe using the 5 senses, the auditory, the sight, the tastes, or tactile touch, and, they practice it for, say, 20 to 30 minutes every day intermittently, and it does help calm them. And they go for a walk, by a river or waterside, which is quite calming for them. I've had clients come back to me and say, oh, mindfulness was quite useful then. It was, was able to help them think. It was able to help them reflect on a lot of things. So do you use mindfulness?
Yes. I'm starting my master's in mindfulness, actually. I've used it a lot. The point of mindfulness for me with trauma clients is this, that they need to feel, if they're going to start dissociating, if they're starting to talk about their trauma, we need to ground them. It's very important that they're grounded. So even before they leave the therapy room, sometimes I would do a little mindfulness pause with them, really. So they'll sort of sit there and be aware of what they're touching, what they're feeling, what they're hearing. We do that thing, 3 things you can hear, 4 things you can touch.
That's correct.
And what it's actually doing is it's slowing the mind and calming the polyvagal system that Porges talks about. Yeah. That sense of calmness and feeling in the moment, in the here and now, so that you don't start disassociating and you need to quite know where you are and you're feeling all raw and shaken up inside. So yeah, mindfulness is definitely one of the recommended, and from my experience, it has worked. And you find a lot of clients think, oh, what for? What? It's a bit silly. What am I doing? And what they're doing is they're not used to that stillness. They're finding it quite strange. They're always used to being buzzy and moving and rushing. So when you ask them to be still, it's almost like, you know, they've got that hurry up drive. Hurry up, what? And they will burn out. You need to say to them, whoa, yeah, you know, as a child, 10 minutes was a lifetime. You know, you live in the moment, but now you're not. You're living always future forward, or you're ruminating over the past. But let's be in the now for a little while. Let's just sit here in this moment together. And, you know, you just see the body just trying to sort of feel like, okay, and just simple things like touch, you know, physical, hear, smell, just getting them to use the senses and switching off, you know, the intellect for a bit.
You're quite right. And I also use the breathing exercises. The AHA therapy, when you suck in your breath, hold it, and then breathe out, exhaling with a whoosh. It does help. I've had people come back and say, oh gosh, they never knew such things existed, but it's quite calming for them.
Do you know what, Grace? There's so much on the internet. I mean, you know, I'd like to tell people today there's a lot out there to resource yourself. You know, there's a lot on breathing, calming breath, you know, for the, you know, getting one of the most, you have that tool in your hand is to use your breath. We do it a lot in yoga. Some of the clients start yoga just with the breathing. And these are all part of the well-being. So we've got the therapeutic, repairing the trauma part, and then we've got the well-being part. So it's like a two-pillar approach, yeah? So it's mainly sort of Western psychology and more Eastern holistic treatments. Even if they go and get a massage, get reflexology, doing things that keep them in the moment and get reconnected with their bodies again. You know, but definitely breath work.
Yes, breath work is quite phenomenal, and it does a lot of healing too. I hope you've enjoyed this episode. Thank you, Sharon, for, you know, coming to talk about trauma and PTSD with me. And I hope to see you in the next episode. Thank you for joining us today.
It's a pleasure. Thank you, Grace. Thank you for inviting me. And also, you know, if any other area they may want to you know, listen to, or they have interest in, you know, they could let you know, and you could arrange another sort of event, you know, where you're bringing in somebody to talk to.
Would you like to share your address or social media platforms, please?
For me personally?
Yes, please.
No, I just use my email address because I work for a charity at the moment, so I'm not using social media as such. That's why I'm supporting you. But what I will do is, you know, I'm out there, you know, helping people in the community with charities on the ground, getting a lot of face-to-face work still. And what I'm trying to encourage people to do, because I know because of the pandemic, which is another trauma, a lot of people are not doing any face-to-face work. So I'm the person who's really on the ground doing outreach and getting to get people to sort of contact each other again. But no, that's really about over to you. I'm flagging up your venture. That's
fine. Thank you, Sharon. So connect.
I'm going to go to see Grace, speak to Grace, and then we'll deliver you on some more information or some more awareness training. It's someone who actually recently took part in a debate in feminism in Camden with you know, a whole group that was like just post-COVID out, you know, facing a venue of people. I you know, I'm becoming aware that we really need to carry on with this fight against hatred of women and abuse, and there's still a lot of it going on, a lot more than people realise. And despite the feminist moves in terms of pay and certain rights, there's still a lot of abuse going on out there, and people need to feel that they're not to be blamed for it. They need to feel they have a right to be treated with respect and dignity. So organisations like yours, Grace, you know, is a great place for those people to come out and to join a community and to feel supported.
Thank you, Sharon. Actually, you're quite right. That's why I'm so passionate about this, because I believe women are entitled to healing, to wholeness, and to their freedom. And that is why this podcast is, very vital for women out there.
If you enjoyed this episode, kindly subscribe to the podcast, share, and comment. You can reach us at risingaboveshadowsofabuse@gmail.com and our social media platforms.
Comment, share it, and see you on our next episode. Thank you. Rising Above Shadows of Abuse podcast with Grace Ofba.